CDC is sounding alarm tonight about firearm deaths on the rise.
This as we see gun violence surge here in Hampton Roads. The agency says a record number of Americans died at the hands of a gun in 2020, and they're worried the numbers will only go up. Allison Basil found out what experts say could turn this violent cycle around.
Firearm deaths are preventable, not inevitable.
Gun violence surged in 2020, according to medical experts with the Centers for Disease Control and Prevention. Their recent study reports from 2019 to 2020, nearly 5,000 more people died at the hands of a gun.
Important to reflect on the individual lives lost.
CDC Associate Director for Science Thomas Simon says deaths in this category went up 35%.
2020 had the highest recorded firearm homicide rate in more than 25 years.
Simon says African-American men and boys ages 10 to 24 had the highest increase in gun homicides, widening the disparities gap.
21 times as high as the rate for white males in the same age group.
Acting CDC President Deborah Oury says hospital-based intervention programs can help. A program already exists in Hampton Roads through Centera Hospitals called Foresight.
Serve youth and young adults who've been admitted to the hospital with gunshot wounds, who provide mentoring.
Dr. Oury says the CDC also suggests community mentor programs to help stop violence before it starts. Norfolk City leaders are working with a group called the Newark Street Team to train community leaders to intervene early.
Connecting populations at highest risk for violence with community services and treatment.
In Norfolk, Allison Basil, 13 News Now.
CDC experts say early data for their 2021 gun violence study shows gun homicide rates during the first half of 2021 are higher than during the same period in 2020.